There are several directions we can try to attack the virus. One is through vaccination and just to create immunity to the virus. And other is through antivirals, small molecules that will be able to stop the virus from infecting ourselves or replicating in our cells. Our research in our lab is focused on a specific type of inhibitors. Inhibitors that are able to irreversibly bind to their target. So because we previously collaborated with the group of Oxford, they knew about our specialty and they were able to ship us a sample of one of the first major viral proteins to be produced, the protease of the virus, which in our lab we were able to screen using a special technology we developed. This specific protease has an active site that allows our approach to be very effective. In our lab, we were able to screen about 1,000 different compounds against the protein they shipped us, and we found a lot of hits. So compounds are able to bind to this protein and presumably to inhibit it. Now we're in the process of generating more potent hits. We now have structures of about 60 different compounds that bind to the active site, and each one binds it slightly differently or occupies a different sub-pocket of the active site. Now we can try and merge and design a second generation of compounds to make them more potent and more suitable for administration. We already synthesized about 30 second-generation compounds, which we're shipping to collaborators in Germany and the UK for testing in live viruses and for activity assays for this protease. This entire endeavor is completely open science, no patents, no IP, no material transfer agreements. Everyone is donating their resources and their ideas, and no one will have rights. And we're hoping that by taking the economic part out of it, we can sort of, through a new model of drug discovery, progress a drug before this pandemic becomes really catastrophic. Medicinal chemists, people who are designing compounds for a living, all over the world, people are recruiting to this effort and joining forces to be able to very rapidly develop a therapeutic to stop this pandemic. We published the structures of all of our hits, their chemistries and the structures in the binding pocket of the protein. And based on this, they can design and come up with creative ideas on how to improve our original hits. And then these suggestions will be prioritized, and we'll try to synthesize and test as many compounds as possible. We were trying to recruit funding to make this happen. We're looking for on the order of $10 million to be able to bring something to clinical relevant testing within an order of months. Working on this project, I really felt that science for the benefit of humanity is not only the Weitzman tagline, but actually comes into reality.